Housekeeping is an important part of the prevention of healthcare-associated infections. The contamination of surfaces and objects in the residence environment may be the cause of isolated or epidemic infectious processes.
Notre EHPAD est engagé dans une démarche d'amélioration continue de la qualité. À ce titre, nous travaillons sur la prévention et la maîtrise du risque infectieux. Cette démarche concerne l'ensemble des services de l'établissement, les soins, mais également les services hôteliers. En collaboration avec le Séclin Sud-Ouest, qui nous a fait bénéficier de son expertise, nous avons réalisé une première auto-évaluation à partir du référentiel national. Ce travail a permis d'identifier les points forts et les points faibles de notre organisation. Nous avons travaillé en équipe pluridisciplinaire sur un programme d'action sur les 5 ans à venir afin d'améliorer et de sécuriser nos pratiques. L'entretien de nos locaux est apparu comme une priorité. Les résidents admis en EHPAD sont souvent très vulnérables face aux risques infectieux. Optimiser le niveau d'hygiène de leur environnement permet d'accroître leur sécurité et leur bien-être.
To illustrate this, we will follow Stephanie at work at the La Chênaie nursing home. Upon arrival, Stephanie consults the table of products and the protocol for alternating between detergent and detergent disinfectant for floors. Some rules are immutable. Gloves are mandatory for all contact with products. Also, never mix products. There is a risk of dangerous chemical reactions as well as a risk of inactivation and incompatibility. The bottles are clearly identified and closed. When using dilution equipment, ensure it is well maintained and kept in good condition. For proper use of products, refer to the manufacturer instructions. Follow the instructions for dilution of the products. Renew solutions accordingly. Observe the temperatures and contact times indicated. Warning: do not use food packaging for cleaning products.
Bonjour Stéphanie.
Bonjour Sandrine.
Comment allez-vous?
Très bien, et vous?
Ça va, je vous remercie. Donc pour ce matin, on a Madame Lucette qui n'a pas très bien dormi. Donc il faudrait, s'il vous plaît, lui faire sa chambre à partir de 11 h.
Oui.
Ensuite, c'est Monsieur Henri qui part en consultation ce matin. Donc on pourrait en profiter pour faire un entretien plus approfondi de sa chambre avec l'autolaveuse.
Oui, d'accord.
Voilà, et puis pour le reste, on fait un entretien courant, comme prévu sur la planification.
Très bien, mais je prépare mon chariot en fonction de cette organisation.
Et à tout à l'heure.
À tout à l'heure.
Stephanie is preparing her trolley by selecting the equipment she needs to perform all the scheduled tasks. She uses equipment in good condition, clean, and complying with safety regulations. The organization of the trolley is as follows. On the top, clean equipment is stored, such as products, sprays, and wipes. Clean reserves are stored in the middle: toilet paper, gloves, and hydroalcoholic solution. At the bottom, the dirty shelf, there is the brush and shovel, bucket for dirty swabs, wipes, and mops. On the sides, there are supports for brooms. The lid of the rubbish container can be removed, foot-operated, or left open to avoid being handled. Warning: do not use the following in care environments: sponges, coconut brooms, or standard wooden handles.
Au quotidien, notre travail est basé sur la planification des tâches à réaliser en conciliant les besoins de l'institution, mais aussi bien sûr ceux des résidents. De plus, certaines tâches relèvent d'un entretien plus approfondi que nous planifions aussi à rythme régulier. Donc ce peut être les bouches d'aération, le dessus des armoires, le nettoyage complet des lits, mais aussi les balayettes, les sanitaires ou les meubles en bois.
Bonjour Madame la Pébi.
Bonjour.
Je vous amène votre linge.
Ah, c'est parfait.
Joelle, the linen technician, first cleans her hands to distribute clean linen.
Merci.
Bonjour Madame la Pébi.
Bonjour.
Me permettez-vous de faire votre chambre aussi?
Mais bien sûr.
Très bien.
Hand hygiene is important before and after cleaning, as well as whenever necessary, particularly when removing and changing gloves. In the absence of the resident, ventilate the room. In their presence, offer them the option and cover them if necessary. Dispose of waste. Descaling products and disinfectant detergents for healthcare have a contact time required to be effective. Stephanie begins by applying this product to give it time to work. Respect a logical sequence in the workflow. Cleaner to dirtier and top down. Stephanie uses a combined disinfectant and detergent to wet wipe higher surfaces. She wipes in a single pass. Sprays wipes and not the surfaces to limit and reduce aerosol dispersion and penetration in moisture-sensitive materials such as telephones or the call bell. Stephanie turns and changes the wipe between each zone and between each room, between the bedroom and the bathroom, for example. A reminder of the technique. Wipe in one pass. Allow to dry. Replace the wipe between each area and each room. Spray on wipes and not on surfaces. Stephanie follows a logical workflow sequence, proceeding from the cleanest to the dirtiest and top down. For daily maintenance, areas commonly touched are wiped to reduce the risk of spreading germs by hand. After changing and impregnating her cleaning cloth, Stephanie will wet wipe higher surfaces in the bathroom using the same sequence. She follows a logical workflow sequence, proceeding from the cleanest to the dirtiest and top down. After changing the wipe according to a pre-established color code, Stephanie wipes and rinses, according to the manufacturer's instructions, the product disinfectant, detergent and descaler she has applied. Stephanie follows the hygiene progress principle. She moves efficiently. Moreover, as Sandra Fernandez said,
Donc le principe de la marche en avant permet de nettoyer tout ce que j'ai à portée de main, de vérifier le bon fonctionnement des équipements et de laisser ou remettre chaque chose à sa place.
For wet sweeping, the gauzes are pre-treated and so are wet and must remain in their packaging. Place a single gauze under the sole of the broom. Wet sweeping should start at the point farthest from the entrance of the room. In one room, in a small space and without furniture, wet sweeping is done through semicircular movements. This operation is used to retrieve 90% of loose dirt on dry and smooth floors, limiting their takeoff into the atmosphere. Never lift the broom. Always remove the gauze from the brush on the threshold. Lock the dirt in by folding the gauze. Dispose of the gauze in the rubbish collector. We are ready to wash the floors. Flat mopping, like any washing procedure, is preceded by wet sweeping. The flat mop relies on a chemical and mechanical action to remove dirt adhering to the floor and microorganisms they carry. When using a detergent disinfectant, there is also a specific disinfectant action. This gives a visual and microbiological cleanliness. The technique is the same as for wet sweeping. Stephanie began with the most distant part of the room and performed semicircular movements. The mop is removed at the door. Stephanie will replace the rubbish bag and would have changed the roll of toilet paper if needed. Window, and makes a visual check to replace the objects in the room if necessary, such as the doorbell or the bed position. It is important to clean the machines by wet wiping. Remember the power cable. Then drain the tanks. Plug in to recharge the battery. Stephanie respects the same logic. She wipes from the top down, the cleanest to the dirtiest. Occasionally, the soles of the brushes will be soaked and dried. The trolley is clean, ready for the next user. As part of the quality process in place at La Chenée, the tasks completed are recorded. The mops and wipes are transported in a closed container to the laundry.
Nous avons des documents de traçabilité qui sont de véritables outils de l'organisation qui nous permettent un visuel global et précis des tâches à réaliser. Pour compléter notre démarche qualité, nous travaillons sur des fiches d'autocontrôle par auto-évaluation de l'entretien de la chambre.
To increase the level of environmental hygiene in nursing homes is to take care of the safety and well-being of residents, professionals and visitors.